All right, well, I think it's about time to get started. Thank you, everybody, for logging in today's Echo Clinic. Before we begin today's session, I would like to go through some reminders for the upcoming month. We will be having our Echo Clinic session today. We will be having our QI Clinic session tomorrow at 12 p.m. Please make sure that anybody that is leading the QI work for this project will be on tomorrow's call. Your data and case study for the next cycle is due on March 10th. And the next Echo Clinic will be on March 17th for physicians, and then the QI Clinic will be on March 18th at the same time. Before we begin today, I would like to go through some housekeeping. We appreciate and value everybody's participation throughout this Echo Clinic. For educational and quality improvement purposes, this tele-echo session will be recorded. By participating in this session, you are consenting to be recorded. Please protect any patient privacy, and please do not provide any PHI information throughout. If you have any question at the end of this presentation, please email me at jsathmere@jaap.org. When you are not speaking, please make sure you mute your microphone. If you are on the computer, the microphone icon is located in the lower left of your screen. If you are on the telephone, please press *6 to mute and unmute yourself. Please communicate clearly during this session. Please speak clearly and use the chat function to send any messages. During today's session, do not put your phone on hold. If you must leave the meeting, we will hear hold music throughout the presentation. I would like to do a quick roll call before we begin. Virtual Mansfield, who is on from your team today?
Hi, Mary Campagnolo.
Hello, Mary. How are you?
I'm good. How you doing?
I'm doing very well today. Anybody else?
Great. I'm not there. I'm in a different office today, so I'm not sure.
Capitol Health Internal Medicine Residency Program. Is anybody here from their team?
Yes, Dr. Mozamis.
Hello, doctor. How are you?
I'm good. How about you?
I'm doing very well today. Freehold Family Health Center. Okay. Palisades Hospital. Is anybody else on from this team?
It's just going to be me, Dr. Khan.
Okay. Well, thank you, Dr. Khan.
You're welcome.
Happy Healthy You Family Medicine. Will anybody be on, is anybody from that practice on today's call? Okay. Robert Wood Johnson Medical Associates. Is anybody on from this team today? Okay. And St. Francis Medical Center. All right. So for today's accreditation statement, each physician and clinician must complete the evaluation to receive any credit for today's session. You will receive an email by close of business tomorrow from me with a link to the evaluation. And here are the disclosures for today's presentation. The following individuals have no financial conflicts of interest relevant to this activity. And now I would like to turn the presentation over to Dr. Khan from Palisades Medical Center. Doctor, you are free to begin.
Okay. Hello, everyone. My name is Dr. Khan. I'm from Palisades Medical Center, and my presentation is going to be about HPV vaccination and counseling. I am PGY1 Family Medicine Program. The learning objectives for today. So Jake here would be handling the slides for me. Thank you so much, Jake. Okay. So let's start with the learning objectives. We're going to discuss about HPV and the types of infections and the cancer that is related to it. We're going to review the HPV vaccine schedule today. We'll discuss about the importance of counseling and strategies to overcome the barriers and the counseling strategies that we have implemented. So at first, whenever we approach a patient, so we have to make sure that we are talking in a language that the patient is understanding. So we will go from basics, like what is HPV, why do they need the vaccination, and you'll also see that these questions are the ones that the patients would ask you. So at first, what is HPV infection? So HPV is the most common sexually transmitted infection in US. There are about 79 million people in US who have HPV infection, so that's the prevalence, and another 14 million who get HPV each year, meaning the incidence. So it's pretty high. Nearly half of these infections occur among the teens, and the young adults. The age where the incidence is really high is 15 to 24. Next question a patient might ask, who can get the HPV? So anyone who is sexually active can get HPV. And so you can get it anytime during your lifespan. And also, it does not matter how many sexual partners do you have or if you have any high-risk sexual behavior. So sometimes patients deny the vaccination because they would tell you that they only have one partner and they think they don't need the vaccination. So you have to remind them that it's still important to get the vaccine. Next question would be, what type of cancers or infections are related to HPV? So first of all, each year there are like approximately 33,200 HPV-associated cancers which are diagnosed in US, and about 20,600 of those are in women, and 12,600 are in men. So it's affecting both men and women. Yes, women more, but also men. Cervical cancer is the most common cancer. Each year there's about 12,000 women who are diagnosed in US, and about 400 die of this disease. HPV vaccine infection can also lead to some other kind of cancer. So it can affect it can cause anal cancer, vulvar, vaginal, and among the men, it can cause oropharyngeal cancer, back of throat, including the base of the tongue and the tonsils. This is what a lot of patients or the parents, they don't know about it at all. Most of the people, they associate HPV and cervical cancer, and that's it. Or somebody would say maybe warts, they know about that. Also, this cancer HPV can cause penile cancer in the men. So some recent data shows that the boys are getting this cancer more often now. So more than 9,000 boys and men develop this cancer from HPV infection each year. The number of the mouth and the throat cancers cases that are linked to HPV is increasing. And if the diagnosis continues at this rate, the HPV-related mouth and throat cancer cases could outnumber the cervical cancer cases by 2020. This is a very important statement, and we need to make sure that we tell our parents and patients that this is very important for the boys also, not only for the girls. So the patient might ask you, are there any symptoms for HPV? Most of the people who have no symptoms never have any symptoms of HPV. Some people can get HPV, with HPV may develop genital warts, and then they will come in the clinic and get tested for it, and they might or might not have the cancer, but the warts still, they will show up to the clinic at least to get tested. About 360,000 people can get genital warts each year because of HPV. HPV infections that cause cancer may not become apparent until many years later, and this may not show any symptoms until the cancer is advanced. So it is very important to vaccinate, and then later on I'll discuss about the screening for the cervical cancer is very important as well, to catch it early or prevent it. So for HPV, the best way to prevent would be with the vaccine. And the important thing is that the vaccine is most effective in the preteens. HPV vaccine works best if it is given around 11 or 12 years of age. At that time, the exposure is less, and the benefit, the immunity benefit is much higher as compared to the later ages. And also, the earlier you get, you will have to get only 2 doses. And if you want to get HPV vaccination after 15, you would need 3 doses. So it's another important thing that we can mention this to our patients. So the next is the HPV vaccination timeline, the schedules for the male and the female patients. So anyone who is between 9 to 14 age would need 2 doses of HPV vaccination. So first one would be, say, today, day 0, and then the next would be in 6 to 12 months. Anyone who is above 15, so from 15 to 26, there would be 3 doses that are needed. So day 0, then between 1 to 2 months, and then another 6 months from that time. And anyone who is above 27 to 45, FDA has approved the vaccine, but right now it's not recommended by USPSTF. So the different FDA approved HPV vaccines which are available, there are 3 different ones. We are using Gardasil 9 in our clinics. So there are different contents of each one, like they protect you against, let's say the first one is bivalent HPV vaccine. That has coverage for HPV 16 and 18 types only. The next one is Gardasil, which is the quadrivalent. It is very commonly used. It has protection against 6 and 11, which cause genital warts, and then 16 and 18, which is heavily associated with the cervical cancer. The next one is Gardasil 9. This is the one that we are using. So it protects against 6, 11, also against 16, 18, 31, 33, 45, 52, and 58. So all these strains have been associated with cervical cancer. So this is best of all. There's multiple printouts that we have in our clinics so that we can give those to the patients, or we place them in our waiting rooms as well. So the patient can go over them by themselves, and then when we go in, they'll ask us questions about the HPV vaccine. So it's just to start a conversation. So the first one is this flyer. I hope you can see it on your screen. This one says that HPV vaccine is best at 11 to 12 years of age. So this is a good starter for a conversation. So that's when we try to catch all the patients as early as possible. So sometimes, even though you provide all this information to the parents or the patients themselves, still they would say that we don't want a vaccination. So then the question is, why? So now at this point, you're going to ask your patient or their parents that, what are your reservations? Is there anything I can answer, like any questions? So there is a data online which shows the barriers to the HPV vaccination. So it is divided into two different parts. The first one is for the parents of the girls, and the other side is for parents of the boys. So there is a big difference among those two. The first concern that most of the patients and their parents would have is about the safety of the vaccination. It's more prevalent in the parents of the daughters. So they will ask you if this vaccine can cause the cancer. So that's an important question, and then you have to address that question for sure. The next one would be lack of necessity. Most of the parents, they would say that I don't think we have any like family history of cancer, so my daughter or my son, they don't even need the vaccination. So you have to make sure that you give them enough information to make sure that they know, they have good understanding that why we are recommending the vaccination and what's the benefit of it. The next barrier is lack of knowledge. So a lot of patients don't even know what it is, so you have to make sure that you explain them in a way that they understand. So the layman language, that would be the best one, rather than using too many like heavy-duty medical words that the patients won't even understand. The next one is the absence of recommendation from the physicians, and this is almost like 10% for the girls' side and 22% for the boys' side. So a lot of physicians even don't think that it is important to get the HPV vaccination for the boys, which is totally wrong. So we need to make sure that now we know about it and we will give the correct information to the parents of those kids to prevent them from having cancer. And the next one is assumed that their kids are not sexually active. So it's important to let them know that even if they are not sexually active right now, they're going to be sexually active one day, and it's important to protect them as early as possible. So the earlier, the better. And the next one is gender necessity. Again, the parents of the boys, they think that they don't need it because they're not going to get the cervical cancer, and that's the only cancer they know about that is linked to HPV. So it's important to give them all the information so that then they can make an informed decision. Even if they say no, they know that there is a big risk to their kids. So the next slide, it shows that the impact of HPV vaccination in the first 9 years after its introduction. So this data shows that HPV 16 and 18 infections that basically cause the warts and the cervical cancer, there was among the girls aged 13 to 19, there was almost 83% reduction in that infection. Also, they looked at anogenital warts. There was 67% reduction in girls among 15 to 19. And the third one is cervical lesions. There was almost 51% reduction among the girls aged 15 to 19. So it is very important to let the patients know about the statistics. That is very important. And this is what the benefit is so that they can make a good decision. So again, as I mentioned, that we have certain printouts in our waiting areas, and so we give them to the patients. One of them here is, it's like a big key, and it says that you can prevent cancer, and the key to it would be HPV vaccine. So this is pretty clear. Anyone could understand it, and then they will definitely ask you questions about it. And the next flyer that we have here, it says certain types of HPV are the major causes of these cancers. So it shows all the cancers. So back of throat cancer, cervical, anal, vaginal, vulvar, and penile cancer. So that the patients would understand that all these cancers are related, and the visual is better because sometimes there's if the flyers are only in English, there would be patients who won't understand it. So that's another thing. We are trying to make sure that these flyers are both in English and Spanish so the patients can understand it. And for the patients who are who speak other languages, they can see the visual images. And when they come in, we usually have the translator so they can help us answer any of the questions that they have. So it also says that the HPV vaccine recommended for boys and girls that can reduce the risk of HPV-related cancer. So it's pretty straightforward statement. Also, the HPV vaccination shows the age, at which age it is important to get it, so that the patients would know that this is the age when their kids are going to need it. So in addition to all these HPV vaccinated related things that we have discussed, we also tell all our female patients who are, let's see, if we are in the PED clinic, we don't usually do it, but if we are in adult clinic, like we have a patient who is above 18, they're coming in. So we would also like to tell them about the cervical cancer screening so that they have that in their mind. And when they turn 21, they can come in and we can send them for the pap smear. So all the women aged 21 to 65, the USPSTF says that they need a cervical cancer screening. It has to be done every 3 years. For women from 21 to 29 years by doing the cervical cytology, that means the pap smear. And for women above 30 up to 65, either the same screening, cervical cytology every 3 years, or HPV DNA testing that could be done every 5 years, or a co-test could be done every 5 years as well. So it's important to let the patient know. I've seen a lot of patients who used to get pap smear every year and they still do the same, and they're above 30, they don't know it doesn't need to be done that way. They can space it out 3 years and all of that. So it's important to tell the patients to know it yourself and then tell the patients that this is what the recommendations are. Any woman who is above 65, that we don't need to discuss it here, but they need only on the basis of if they have any high risks in previous years or any abnormal pap smears. Okay, so the next one is the slide that shows a little bit of improvement that we are able to achieve in our clinics here at Palisades. So when we started the project, the data, I would say the numbers were really bad. And I know there were some doctors, physicians, they were trying to counsel, but we were not emphasizing really on the HPV vaccination. But since we started the project, I think this is a benefit for us as well as our patients, that we have been making sure that at this particular age, we counsel the patients about all the screenings that they need, including the vaccinations. And we do see some improvement. So the only a few things that were difficult to do during this process was that sometimes when the parents are accompanying their kids, especially in the pediatric clinics, they would say that if they only have boys, they would refuse the vaccination, saying that I don't think the boys needed it, it's only for the girls. So we have to then tell them this is about the throat cancer and all that. Sometimes the parents say our kids are not sexually active, so we are not going to agree to vaccination right now. If they become sexually active, we'll come back again. So there are like multiple things that we have been hearing. We're trying to make sure that we correct this general idea about the vaccination, give them the accurate information. So Now, basically, our approach is that we try to counsel each and every patient and their parents who come in and are at the specific age for getting the HPV vaccination. We try to get their previous vaccination records from other offices so that we know if they were vaccinated or not. In a lot of cases, the patients would tell you that they don't remember, so it's important to get the data from the other offices in that case. So most of the times above 18, when the patients came in alone, they were more amenable to the vaccination. They would get it. The only thing was at that time they would have to get 3 doses. And if they have gotten it before 15, it would have been 2 doses. But nevertheless, it's important to give them vaccination at whatever age they are agreeing to. So less than 18 again, parents were with the kids. They had a lot of questions and they were trying to say no. A lot of parents were trying to say no for the HPV vaccination until we provided them data, and then we have been seeing a lot of improvement. The next thing is, since it's a series, not a single vaccination that you would just give them a shot and then they're good. So it's very important to make sure that they are coming back in order to complete their series. So now in our, so whenever our patient, they leave the office, we make sure that there is, in Epic, there is like a flag, which tells the office managers that this patient needs to come back at this time for their vaccination series to be completed. It's same for hepatitis B or other vaccinations who come in the series. So we make sure that we call the patient and have them come in again, because sometimes patients forget that they need to get more vaccinations. The parents forget, they have other things going on, and then, you know, they miss the appointments and don't get the vaccination. So we try to make sure that they come in. And also we remind them that in case they move to a different city or something like that, we give them a call, tell them, okay, you have gotten 1 dose, you need another one. Make sure when you go to your doctor in the new office, you get this vaccine so that your series is completed and you are protected against the HPV-related infection. And I think that's pretty much it. If anybody has any questions, you're all welcome to ask me about the vaccinations. Thank you so much. It was my pleasure to tell you a little bit about HPV vaccination. I think a lot of people already know it, but just a friendly reminder. And yeah, thank you so much.
So thank you for the excellent presentation. I'm excited to see that your numbers have increased. And so I'm curious, what are some of the things that you've done in your office? Did you have a presentation for all the, you know, like MAs and nurses, or just for the physicians? You know, seems like clearly there's more counseling that's happening now than there was before you started this practice. So I'm just curious as what you think has contributed to that happening more often.
Yeah, definitely. So, as I mentioned already, like, I don't think there was enough counseling going on before the project started. And now, as soon as the project started, we like gathered all the residents, and during our didactic session, we had a presentation about all the vaccinations, not just HPV, to make sure that everybody is clear about how to answer the questions. We should know the statistics, the numbers, the importance, the sensitivity, specificity, all of those things in order to tell the patient. So we need to be informed first before we can inform anybody else. So that was one thing. Also, now all our office managers, they know that they have to make sure that for the completion of the series, each of the patient has to come back. So they make sure that they call them back, keep on reminding them until they come back to the office to get the vaccination. So I think that's another thing in the office, which has helped us a lot to make sure that the vaccination are given in the specific ways. Also, I would say that now all the residents and the physicians, they are trying to make sure that we are protecting our patients, including, like, as I mentioned already, the parents of the boys, they were like really saying no to the vaccination, and nobody was giving them the exact counseling about that. So I think that has helped a lot as well to increase the numbers.
Have you had a chance to give this data back to the office so that they can see the improvement that they've made yet?
Oh, yes, definitely. our office managers, everybody know about it, about the data, and they're very excited. We usually print out at the end of every month so that they know, like, it's like a positive encouragement for everybody.
Any other questions that anybody has?
And also one more thing, sorry.
Yeah.
As I already mentioned, that we have like printouts that talk about the vaccinations in the waiting room, so the patient can look at them, and then when we go in, they ask us about everything. So I think that has also played a very positive role.
And the printouts are just for HPV or for all of the different vaccines?
For all of the different vaccinations. Oh, go girl.
Okay, thank you very much. Jake, if you want to advance to the next slide, I just wanted to present a paper that was published just in January of this year, looking at the economics of the HPV vaccine. And so we know that, so this is a study where they looked at comparing it to no vaccines over the next 100 years, just for women up to age 26 and men to age 21. And as you can see, there's, you know, the 82%, 32 million, 80%, 13 million of decreased incidence, diagnosis of either the warts or the cancer. And so then they also looked at this, if you expanded that to age 45, which ACIP now recommends, but the US Preventive Services Task Force hasn't recommended yet, you really don't get that much more prevention of disease for the amount of money that would be spent. So my guess, it may be difficult down the road that the US Preventive Services Task Force may not come out and support that as fully, because you don't get that much more benefit from it. But what this reinforces to me is what you were showing as well, that we really need to make sure that we get the kids the vaccine when they're 11 and 12. That's going to be much more effective. There was also an article that came out this last year looking at the economics of giving just one vaccine versus giving two. And it was particularly looking in a resource poor country. I think it was done in Uganda. And so when you give just one vaccine, the effectiveness is about 70%. When you give two, it's about 90%. And then they did a mathematical model and looked over like 10 years. And so bottom line to me, it made more sense in a resource poor country to get more people just one vaccine than less people the two vaccines. But we aren't in a resource poor community, so we really should be getting all of our younger folks two vaccines at a very young age, because the effectiveness is much higher. And so I think Michael has some data that kind of reinforces what had been presented earlier, looking at the effectiveness of that. So I think, Michael, are you on? And next slides.
I am here. Thank you, Doctor. And furthermore, I'd like to congratulate Palisades, because that was just a fabulous improvement and continuation of more success in that regard. So, Dr. Barter, maybe you want to do the first one. This is the one that you had put together, essentially talking about the same information that you just revealed, but it gives us a little bit different way of looking at it that potentially is a little bit more impactful in terms of the reduction or the disappearance in genital warts. And this is out of the studies, the ongoing studies in Australia. Do you want to add to that?
No, I really think, again, the more we can get young kids their vaccines, the incredible effectiveness is it. So it's hard to imagine that parents wouldn't want to participate in this, but I know we have lots of folks out there that are leaning towards completely anti-vaccine of anything. But I think the misconceptions about, well, your kids have to be sexually active before you give this vaccine is often misplaced. So other than that, I don't have anything else to add.
Okay, and indeed, and as Dr. Khan said earlier, when we were talking about incidence and occurrence, the 7 million that occur each and every year, half of those are from kids that are 15 to 24 years of age. So that's another substantiation of the importance of getting this done early. Okay, and then the next slide, We'll look at a couple of things here, talking about the impact and the ages, along with the continuation of protection. So the first one, and I always like working with when you have pieces in the office that just kind of give very simple but very dramatic information. And so again, and this was part of the information that came out of the study that continues to go on in Australia. And of course, they had a little bit of an advantage. They were able to implement this nationwide in pretty short order, which is a little bit more challenging than, of course, we have it here. But when we look at the age of vaccination, to Dr. Barter's comments earlier, that when it's done earlier, the impact and effectiveness against both anal warts and cervical cancer is dramatic. So when we switch from 12 to 13 and completing it when they're 17 years old, we're dropping from almost a little bit over 85% to just a little bit over 50%. And if it's done, completion of the series is done at age 18 or older, it drops down to 15%. So I look at those numbers, as I hope you will look at those numbers, and let's translate that from percentages into number of people that are affected by preventable cancers. And so the sooner we get it done, the better off the patients will be. And it can go actually now to as early as 9 years. But what we really want to be doing is getting the series completed before that 15th birthday. And the big benefit to patients there, of course, is, well, then it's for the most part only 2 doses as opposed to having to move to 3 doses. But as the general overriding theme, it is the prevention of cancer. And this is where our conversation needs to be focused. On the next slide, really 2 moving ahead, it's the long-lasting. I mentioned a little bit earlier, and this is why, that ACIP has now come up with approval to offer it at 9 years old. But there was some concern on the part of some physicians that, well, if we do it earlier on, is the longevity of protection or the immunity going to last? And so when we look at the data now, you can clearly see from the chart that the protection it lasts and lasts and lasts, and there is no indication at this point, last I heard, that there is any need for any booster dose. Of course, that's always a possibility. We've seen it happen in other immunizations, but we know that the protection that's offered even as early as 9 years now lasts well beyond the time of concern. And then the important point here to keep in mind, again, when we're talking about cancer prevention, I'll use this as an example right now that there's a lot of conversation pertaining to the novel coronavirus and how people are very interested in getting the vaccination because they clearly understand it's a protection agent against this. Well, it's the same thing applies to the HPV. Dr. Barter, is there anything else that you would like to add to those?
No, nice
Okay.
job.
So that's it, and I guess the following here, and I think you have a couple minutes, Doctor, if you would like to do the action steps for tomorrow, or I'm happy to run through those. Your call.
Yeah, if you can go through that, because
Okay.
I've got to get a family member to a doctor's appointment. So I'm
Okay.
going to sign off with you.
Thank you very much. So as we already heard from Dr. Khan, and there was, I found it very interesting that there was an uptick to her voice when she talked about the project manager sharing the information with the team itself and the enthusiasm that ensued after that. When you see those kinds of numbers and that kind of progress, well, that's a good kind of infection. So we're asking in advance of tomorrow's clinic is to review the charts and talk about it as a team. and share with each other, what does this data appear to be indicating to you? What's it telling you? Are you heading in the right direction? And you have that information. And then, you know, it gives you better insight as to, you know, how confident you are about achieving those goals that you set for by June. We all know that the Healthy People 2020 goal was 80% in HPV, for those of you who are pursuing HPV as one of the vaccinations. But look at that and see, is your data telling you that you're headed in the right direction to achieve that goal by June? As you go through those, we had asked that your team be ready to share the information and your feelings about what that information is telling you in tomorrow's QI clinic. And that's it on my side. I don't know if there are any questions. Anybody have anything else to add? Okay, now we try not to have everybody ask questions all at the same time. But having said that, we all, on behalf of everybody on the call today, we thank each of you for participating in these calls. You know where to reach us should questions come up after the fact, and we look forward to hearing what you have to add to the conversation on tomorrow's clinic.
Thank you.